My name is Yutaka Inaba from Yokohama City University, Japan. So the title of my paper is Selective Pharmacological Prophylaxis based on individual assessment using the soluble fibrin and plasminogen activator inhibitor 1 following total hip arthroplasty. So we have previously reported screening method of post-operative VTE using the blood markers. In the result of our previous study, the plasma levels of soluble fibrin, the SF, and plasminogen activator inhibitor 1, PI1, were useful to detect the high-risk patient of post-operative VTE after total hip arthroplasty. We also obtained the cutoff values of each markers. So for soluble fibrin, 19.8 microgram per milliliter, and for PI1, 53.5 nanogram per milliliter. Therefore, in the present study, we prospectively performed the selective chemoprophylaxis of postoperative VTE using these SF and PI1 after total hip arthroplasty. In this study, we defined the high-risk patient as those with elevated levels of soluble fibrin or PI1 on the day after surgery, and we defined the low-risk patient as those with lower levels of soluble fibrin and PI1 on the day after surgery. In 246 patients, 131 patients were defined as high risk, and 125 patients were low risk. And we performed the chemoprophylaxis using the anticoagulant hondaparinux, the selective factor Xa inhibitor, only for high risk patients. We did not perform the chemoprophylaxis for low risk patients. That means the selective chemoprophylaxis. And in the result, 8% of high-risk patients developed VTE, and only 4% of low-risk patients developed VTE without chemoprophylaxis. In terms of major bleedings, 2% of high-risk patients and 1% of low-risk patients developed major bleedings, and there was no statistical difference between the two groups. We believe the measurement of soluble fibrin and plasminogen activator inhibitor 1 is very simple and could be helpful to detect the high-risk patient of postoperative VTE. And from our result, half of the patient may not receive the chemoprophylaxis, and we can decrease the bleeding events as an adverse effect of anticoagulant for such patients. We believe the soluble fibrin and the measurement of PI1 is very simple method to detect the risk of the VTE after total hip arthroplasty.